Hello, everyone. Bonjour tout le monde. My name is Leigh Chapman, and I'm the Chief Nursing Officer with Health Canada. Je suis l'infirmière en chef du Canada. I'm delighted to provide some opening remarks ahead of your conference for 2026 on neuroscience nursing, precision, passion, and purpose. Je suis l'infirmière en chef du Canada. Je suis ravie d'être ici avec vous aujourd'hui virtuellement. So I hope that for all of you there in attendance today or at this time for this year's conference, that you do take time as well to share in the conversation with your colleagues from coast to coast to coast, as well as international colleagues. But I also hope that you take time to pause and reflect and spend time in nature in beautiful Canmore. It's one of the most beautiful places in this country. And so, of course, I do hope that you're also taking some time to regenerate and restore in the beautiful nature that is Canmore. Because you're meeting in May, I wanted to also wish you a belated Happy Nursing Week. I hope you all took time to celebrate the profession just a few weeks prior. This year's theme for National Nursing Week was the power of nurses to transform health. And that's definitely very prominent in the work that you do every day as neuroscience nurses. I want to applaud you for your engagement in the professional association for your specialty area. I think you are a testament to the expertise that nurses develop and why it's so critical that we retain nurses because you are developing um, and acquiring such rich expertise in the area of neuroscience nursing, which is ever evolving as we continue to learn more about the brain. I know that you're all dealing with a tremendous amount of health workforce challenges and certainly challenges in our health systems. But I know you're also dealing with patient complexity, and that it is, I'm sure, a challenge in the work that you do every single day to meet patients' needs in an evidence-based and compassionate way in the work that you do. I know that you're also dealing with different challenges like mental health in the population that you're caring for, chronic disease management, as well as the challenges when you think of navigating neurological injuries that may be transitioning from sort of the acute care sector into more complex continuing care, rehab, and long-term care, and navigating those challenges between different sectors. And nurses are really the experts in navigating all of those disparate parts of the system in really ensuring that they are advocating for patients, but also putting the needs of the patient at the fore of all of those advocacy efforts. But I know there's also new challenges in the field of neuroscience nursing when it comes to diagnostics. And so I hope that you really take advantage of the learning at this event and learn from your colleagues, learn from the best practices that are occurring across the country, because it is really my belief that despite the challenges that exist in health care and health systems across the country, we have a responsibility to really elevate the exemplars and the best practices, and then try to scale them, try to spread all the good work that's happening as much as possible from coast to coast to coast for the benefit of people in Canada. So have a wonderful conference. I hope that you have lots of time for learning, but also lots of time for fun. And I hope that you all feel the great privilege of being in most beautiful part of Canada and take all the key learnings back to your colleagues who may not have been able to come to the conference. So thank you very much. Merci beaucoup. And I really want to thank you for your commitment to the profession, and in particular for your passion and for your purpose. Have a great conference. Thank you very much. Merci beaucoup.